Since the third lockdown began, the number of infections has been falling rapidly. But the age distribution shows that the planned easing could come too early. At the beginning of January, the corona mutant B.1.1.7 brought the British healthcare system to the verge of collapse. New infections reported daily hit the new pandemic high in the UK of around 60,000 new cases. The proportion of positive tests in the total, the so-called positive rate, rose to around 13%. The result was 40,000 corona patients in British hospitals, 4,000 of whom were ventilated, and 1,300 British people who died of or in connection with the coronavirus. The sense of achievement, the falling number of infections after the second national lockdown, were gone in one fell swoop with a new B.1.1.7 variant. A third lockdown was needed, an even harder one. A lockdown that actually contained the contagious virus. Most recently, the National Health Authority NHS reported around 12,000 new cases, 1/5 of the high 6 weeks ago per day. According to a study, the number of those who currently tested positive for the coronavirus in England has even decreased by around 2/3 since the beginning of January. That is the central result of a study published on Thursday by Imperial College London, for which tens of thousands of randomly selected citizens are regularly tested. If the test was positive at more than 1.5% at the beginning of January, it was only a good 0.5% at the beginning of mid-February. In London, which was particularly badly affected, the proportion of positive tests even fell by 80%. When looking at all tests in Great Britain, according to data from Our World in Data, it can be seen that the positive rate also fell significantly across the country in the past 6 weeks, from around 13% to around 2%. In Germany, the positive rate is higher in comparison. There it is currently around 6% after having risen to a high of around 15% in early January. Observers attribute the development in Great Britain to the hard lockdown that has been in place since early January, and not yet to the increasing number of people vaccinated with the first shot. The infection rates are still very high, said the scientist involved Paul Elliott in a BBC interview. They are as high as they were in September when they went up, and there are currently as many people in the hospitals as there were in the first wave. So we have to be very careful. The development in England, which applies similarly to the whole of Great Britain, reflects a trend that can also be seen in other countries. For example, on comparative maps from the University of Oxford. In the United States, there was also a steep downward trend in January. In Germany, where the mutant B.1.1.7 is currently rampant in several hotspots, and other countries, the number of new cases also fell, albeit less rapidly. In countries like Sweden, however, the situation is only now getting really out of hand. The lockdown that Prime Minister Boris Johnson announced on January 4th in response to the spreading mutant B.1.1.7 is also significantly tougher than the one in Germany. People in Great Britain are only allowed to leave their homes in a few well-founded exceptional cases. These exceptions can be the absolutely necessary commute, shopping for essential groceries, medical appointments, or going to church. Brits are also allowed to go out of the house once a day to do sports. You're not allowed to meet people in other households unless, for example, it is necessary for care. Brits who disobey the rules can face fines up to £10,000, that's around 11,500 euros. In addition to the tougher measures, Great Britain hoped for quick success with the vaccination campaign and also massively expanded the test capacities. The number rose from 430,000 tests on the day that was announced earlier to a high of around 670,000 tests on February 6th. Since then, the number of tests has decreased again. The falling number of infections also gradually had an impact on the number of hospitalizations and deaths. After an average of 4,000 corona patients had to be admitted to hospitals in Great Britain at the beginning of January, the figure was recently only around 1,500. The latest data from the ministry shows that around 20,000 corona patients are treated in hospitals and a little more than 2,500 are ventilated. In mid-January, there were twice as many patients. The number of deaths from or in connection with the coronavirus fell from 1,300 people to less than 500 a day recently. The number of reproductions in Great Britain recently fluctuated between 0.6 and 0.9, according to data from the British Ministry of Health. This means, on average, one infected person infects less than one other person with the virus, although 0.8 is already bad. According to these data, the 7-day incidence recently fell by between 3 and 6% daily. The trend shows that the number of infections in the UK is currently halving every 15 days. If this trend continues, the number of new infections per day will be less than 1,000 in 6 weeks. There are currently 450,000 vaccinations per day. A total of 25% of the British are already vaccinated with the first shot. More than 90% of people over 70 in the UK have been vaccinated with the first dose. But scientists see no influence of the British vaccination campaign on the low number of infections. And that's because the number of infections in the age group of those eligible for vaccination over 65 years did not decrease more than in the other age groups. According to the study by Imperial College, the coronavirus is now comparatively most widespread in the younger age groups among 5 to 12-year-olds and 18 to 24-year-olds. The researchers at Imperial College suspect that the comparatively high number of cases in the young age groups is due to the fact that children and young people are still going to school. A study from February showed that around a quarter of primary school students are still being taught personally. Mark Woolhouse, an epidemiologist from the University of Edinburgh, told The Guardian, "I think there are reasons to be more confident than at the end of the first lockdown. Studies have shown that school openings have not caused an increase in corona cases, according to Woolhouse. Other experts, however, warn against reopening schools quickly and urge caution. Prime Minister Boris Johnson is expected to announce today that schools will be allowed to reopen on March 8th, initially for the youngest students. This is what Northern Ireland announced on Thursday. There, the lockdown was extended to April 1st, with one further exception that some shops are allowed to offer pickup services again. In his address on Monday, Johnson will announce the timetable for the coming weeks, which could include the earliest possible opening steps. So I'm looking forward to this today. In addition to the school closings, far-reaching exit and contact restrictions, carefully but irreversibly, are to be lifted, Johnson announced this week. However, the Prime Minister also made it clear that the easing would be withdrawn immediately if the infection situation turns negative. Ahead of the upcoming easing, a senior State Department official told Sky News on Friday that the UK government could not rule out a possible fourth lockdown. It is not possible to give citizens this security, said James Cleverly, who represents Great Britain in the Middle East and North Africa. Viruses don't work like that, says Cleverly. But we want it to be the last lockdown. That's what we are working towards. And in my hometown, it's looking quite good compared to many other cities in Germany at the moment. But it can change rapidly as well. So we all have to watch out how we deal with it. And if you want to stay informed, please subscribe to my channel and to my other channels. I'll see you in my next video. Auf Wiedersehen.